and welcome to all of our Gold viewers who are here with us today. I'm Kristen Schwartz, licensed midwife and one of the MCs here at Gold. And I have a guest with me here today. It is Dr. Kathleen Kendall-Tackett. Welcome, Kathleen.
Thank you very much for having me.
You are, of course, part of the lecture pack here that we're having a brand new lecture pack titled Breastfeeding and Perinatal Mental Health, Practical Tools for Fostering Emotional Safety. And your presentation is titled Interplay of Oxytocin and Stress Systems, Impact on Breastfeeding and Mental Health. This is so exciting. Can't wait to talk to you about this. But first of all, I mean, you have been with Gold before, but for those of our viewers who have not yet met you, talk a little bit about your amazing background, first of all.
Okay. Well, I'm a psychologist by training. I started in developmental psychology, but found that, eventually it kind of wasn't really fitting my areas of interest. I still kind of in some ways think developmentally and think about kind of how things change kind of over, developmental periods and lifespans. But I found a new home in health psychology. And I actually really found that I liked it. I was very, very interested in studying why adult or childhood trauma influence adult health, and health psychology was actually just a really good match with that. And I found it actually really fits with trying to kind of understand some of the mental health effects in the perinatal period, and I had kind of a big sort of breakthrough when I was actually working this one summer on two different presentations at the same time, one on the health effects of trauma, on cardiovascular disease and diabetes. And I was also looking at what's new in perinatal depression, postpartum depression. And I realized, oh my gosh, these are the same. I'm actually doing the same thing. And it just kind of blew my mind, and I kept kind of pulling articles out and going, oh my gosh. And it was like, it was just this kind of amazing thing that sort of clicked. And that was actually, again, coming from the health psychology literature, but it was looking at the role of inflammation and how it influences mental health. And see, the thing that's really interesting about this is then it tells you why breastfeeding is important, because breastfeeding is the thing that counteracts that. Okay. And so that's the work I've been kind of doing. I mean, I've got actually a recent project now. I've been looking at some data on cannabis use during pregnancy and breastfeeding, looking at kind of mothers' reasons for that. And not surprisingly, we're finding, a huge amount of trauma in that population, because again, like I said, if you think about somebody would be at a point where they would use cannabis, which actually in many states is still illegal during pregnancy and breastfeeding. I figured there was probably, oftentimes, we think, oh, well, they just shouldn't do it, but we don't really want to know the reasons for it. And It's kind of like they really have reasons for it. And it's like a lot of it had to do with trauma, and particularly sequelae of trauma. So again, it comes back to that mental health piece. It's like if they had depression or anxiety or PTSD or some of the kind of common things that happen, then they were more likely to use cannabis more frequently. So again, another piece that comes back to that breastfeeding or that mental health piece is like the mental health piece is just kind of critical. But I also edit the journal Psychological Trauma, which has been, a fantastic experience. I've been doing it for the last 10 years. It's, an amazing, amazing journal. I have a great team, but, for me, it's broadened my perspective about traumatic events beyond just, childhood trauma, which is where I had spent a good part of my career. And looking at, military trauma and disaster, and, kind of like expanding it. And kind of, I think it's increased my conceptualization of it. So again, like all these kind of different pieces that don't seem to have anything to do with lactation. Lactation started as a hobby, frankly.
That's interesting. Fascinating.
I started as a leisure league leader, and it was like that was supposed to be my happy counterpart to all my depression. And then people keep saying, "Would you come and lecture on this?" It's like, I said, I can't lecture on, child sexual abuse and breastfeeding. There's zero research on it. And they're like, please, please, please. So it was kind of like, okay, I thought, well, I can talk about what we do know, and then I can think about, okay, how that could possibly influence people. But again, it's always the kind of comes back to the, those kind of mental health things. All of these different things always come back to, are we looking at their mental health? And oftentimes we are not, and we really should.
And when we're looking at mental health, and this is an interesting, and I think you will speak to this in your presentation too, we focus on, mental health. Oh, we know sleep, a lack of sleep, that's not good for your mental health, especially if you are prone to, depression or anxiety and things like that. So the first thing that happens is, okay, let's give the baby a bottle or formula because then the parent gets more sleep. And that's so counterintuitive and not correct, right?
It's
I mean, so talk a little bit about that, Kathleen.
Oh yeah, that's something that has come up over and over and over again. Especially, I see this in the perinatal mental health field. They'll say, well, you just need to not breastfeed at night. That's what you need to do. And it's kind of like, okay, how exactly is that going to work? Because, like we asked, do you have somebody who could take over nighttime feedings? And it was a small percentage who said yes. So I mean, it's one of those things that we say, oh yeah, that's going to be a good idea. But then we, we don't really think about the conceptualization of it, how it's going to actually work. But just what we know, you do that, you are actually going to interfere with the natural protective processes. And again, I have kind of like what I call sort of an emergency strategy. Like, let's say you've got a mom who's in that situation where she is hanging on by a thread.
Right.
You get those. And I think we do need to really be aware of that. We need to be sensitive to that. Okay, so here is my strategy. Instead of doing that, try to do 6 hours of uninterrupted sleep. Really what the literature shows, if you can do a 4-hour stretch. Okay, and so this is actually what you need. You need to actually you need somebody awake during that whole time. Okay, so if you've got a, say a partner who's got to get up and go to work the next day, here's the kind of practical thing I would suggest. Start at 8 o'clock at night, go to midnight. If you're awake partner, because the reason you need that is because otherwise the mom's going to be the first one to hear it because she's wired for that baby. So you're going to have somebody, and she's going to have to know that baby is going to be taken care of. Otherwise, she's not going to relax enough to go to sleep. Okay, but you get to the point where you can do a 4-hour, and then the baby can come in and be with the mom and and feed at night. But if she gets that, I think it's going to just really turn things around. And again, thinking about that as an emergency strategy.
Yeah.
But I think you can do a 4-hour stretch without getting terrible mastitis. But you start talking about these 6-hour. I mean, it's going to be ridiculous.
Yeah.
First, you're going to get mastitis, and then it's going to cause involution, and you're going to end up losing your supply. So it's bad advice from the breastfeeding standpoint, but let's just put that aside for a minute and say, does this help with mental health? And the answer is no. And it's like, let's look at some studies. And it's like this, I kind of like laid all this out in the book, and I said, people will tell you this. And I said, but I prefer to look at evidence. Let's look at some evidence. And it's so consistent. That's the interesting thing.
Yeah. And that's the interesting thing, because there is now the evidence available, right? And I think the prior method, what you talked about, is like, okay, let's, give the baby to dad, or, somebody else feed the baby at night so mom can sleep. That was based on not evidence-based information. It was just something that people think, oh, you just need to sleep more.
They sit there and they kind of like think about sleep as you would for somebody who is not postpartum.
Right, exactly.
That's the thing. If this is different, and it's like, I remember Helen Ball and I were on a panel one time, and for me, it was the middle of the night, so I wasn't exactly at my sharpest, I have to be honest. But this, English psychiatrist was sitting there saying, well, we got to do this, sleep. And I kept saying, well, how is the baby feeding? Because that's going to be critical. Because it's like, yes, this is a strategy. If you've got a mom who is exclusively formula feeding, then you can actually apply the same rules that apply, with a non-postpartum. Okay. But if you've got, a mom who is breastfeeding, you are going to be interfering with the natural protection that breastfeeding provides if you do that. And also too, what kind of happens is there've even been hospital programs where they've taken the baby away, but the mothers don't go into deep sleep because they're listening down the hall. Is that my baby crying? It's like, so it just doesn't work. It's like we're wired a certain way, and we're wired a certain way for a reason. So it shouldn't interfere with that process. Now, the exception would be like if you've got somebody with, a mom with bipolar, because that's kind of a little bit different. The sleep deprivation can. So we're going to be very, very careful then. And then maybe we do the thing where she does the 4-hour stretch or something like that. So we kind of working around that. But for even with a mom who has depression, I think she's going to find that this is going to actually ease some of her symptoms. Having the baby there,
and you have some new research on that. You have some, you're talking about that in your presentation. So this is now really exciting that the information you're sharing there in the presentation as well on this, on the oxytocin and the absolutely fascinating. So tell us just a little overview there, just briefly, because we want to have people come to your presentation and learn from you. And yeah, so go ahead.
Well, I think one of the things that's really important is sometimes people are they make these sort of blanket claims that if you're doing, any amount of breastfeeding or chest feeding or, like that you're going to get these mental health effects. And it's kind of like, that's not necessarily the case. I would say there are some, some caveats here. First, it has to be exclusive. That really, I mean, I honestly, as I said in the presentation, if I was queen of the world, I would make it so that you get benefits from anything, any amount, because we want to support any amount that the mothers are doing. But there does seem to be this sort of threshold you have to reach to actually get that really down regulation of the stress system. That's what we're kind of going for. We want to have that down, but you get the temporary, you do get that, and so you have a temporary. But the other thing that's really interesting, and this is actually a paper that Kirsten Moberger and I are working on right now. Actually, we're going to submit it hopefully, within a couple of weeks. But looking at the comparison of holding the baby, which we know actually does downregulate stress response, but it does it in a different way versus suckling. Suckling at the breast seems to actually do differently. It works in a different part of the brain. So instead of working, like at the brain stem, which is, kind of more sympathetic nervous system, it actually goes up into the hypothalamus and then the pituitary, and that's what downregulates that, the action of the HPA axis and the inflammatory response. That's where you get the antidepressant effect right there. So it's that suckling that actually triggers that. Now, you do get some of that effect with the pump, but if it's exclusive pumping, we don't actually honestly know if it would be completely equivalent, but you do get some of that effect because of that suckling and the milk injection, and it's the pulses of oxytocin and where it goes. So again, like I said, if you got a mom who say exclusively breastfeeding, she's pumping a couple times a day, is she going to get the same effect? I would say yes to that.
Absolutely.
If she's exclusively pumping, she will definitely get some of this, but we don't know how much. So she definitely will get some. And I would like those mothers to have every single bit, because that's hard. That's super hard. And I would like them to get every single bit of stress reduction that they can. And we want to encourage everybody, that you're going to still get lots and lots of other things. You're going to get a temporary lessening of the stress response every single time you feed that baby. So that's good. That's all good. But oftentimes we offer advice that just cuts out exclusive breastfeeding. We don't realize kind of what we're doing. We're making it worse. And I said, mental health providers are the worst. And so I actually get into trouble a lot because I go to perinatal mental health things, and they're like, "Oh yeah, you're the lactation one." It's like, well, yes, I will cop to that. That is me.
Yes. But this is absolutely fascinating. Kathleen Kendall-Tackett, it is fantastic information right there, because I think we have not heard that before. The difference of the suckling and actually the holding is really fascinating, and that there is now evidence for it, and that you researched it. It's and you will talk about it more.
Understand the actual nerves that
Exactly.
I mentioned. Yeah. That's actually from the paper that we're working on right now. And it's like,
fascinating.
Wow, gosh, that's interesting.
Yeah, absolutely fascinating. Well, this is all the time we have for today, but it's always good talking to you, and it's absolutely fascinating research and work you are involved in right now. And we can't wait for your presentation here. Again, the title is Interplay of Oxytocin in Stress Systems, Impact on Breastfeeding and Mental Health, which is part of the brand new lecture pack, Breastfeeding and Perinatal Mental Health, Practical Tools for Fostering Emotional Safety. Thank you so very much being here today, and it was such a pleasure hosting you today.
Well, and you know what? Thank you for having me, and thank you for doing this pack. I am thrilled that you guys are doing a special pack on perinatal mental health. So, that's awesome. That's my dream. It's been my dream. So, I mean, I'm really happy about that.
Thank you so very much. And for our viewers now, of course, you want to find out more and where to find this amazing lecture pack. Right now, it is the add-on package for our Lactation Conference of 2024. So go to goldlactation.com to find out the information about this presentation and the other presentations in this wonderful lecture pack. And we also hope to see you at the Lactation Online Conference here starting in April. Thank you, everyone, for participating today with us here, and we hope to see you very soon. Bye-bye, everyone.
Bye.